Chronic diseases are a serious problem that affects millions of Americans and billions of people all around the world, myself included. They're not just a matter of discomfort and pain. They can have significant effects on your life, causing long term health damage and really have devastating consequences if you don't get them under control. It's important to understand how to manage these chronic diseases or a chronic disease that you may have, because by doing so you can prevent risk from other chronic diseases. But with all those things being said, here are 10 tips for you to consider if you or someone you love has been diagnosed with a chronic disease. Number one, it's really important to understand your condition. The first thing you need to understand is how it's going to affect you. This will best determine how you can manage your symptoms, and will also help you when you seek information from medical professionals about your condition. Understanding the condition can also help you understand the treatments that might be available, so you can make an informed decision about the treatment options that might be best for you. Number two, kind of going along the same lines, make sure to get educated about your condition. If you have a chronic disease, don't focus on managing the symptoms. I mean, you want to do that, as I said earlier, but you really want to focus on learning the condition as well. Because the more you learn about what's happening inside your body, the better you'll be prepared to manage the changes that you might have that will affect your health over time. And it may even lead to some breakthroughs in treatments for your condition. So don't forget to share what you learn with others and your medical professionals as needed. Next, make sure to develop a treatment plan. And that's probably not going to be something that you're going to be able to do on your own. But once you know everything you need to know about your condition, it's time for you to figure the best way to manage it. And this goes beyond just medication. Things like type 2 diabetes can be reversed with the proper diet and exercise techniques. So don't be afraid to look at other options outside of just popping a pill to manage your condition. But you're going to want to next talk about your symptoms with the doctor. It's no doubt that doctors are busy folks, but that doesn't mean they don't have time for you. If there's something that's bothering you currently, or perhaps with your treatment plan, it's really important for you to let them know about that. It's important for you to talk to them about these things. They want to make sure that their treatment options that they prescribe are effective for you as well. And they want to understand that if there's something that they're doing, it might, if it's having a side effect that's affecting you, they want to know that as well. And this kind of goes along with next, being your own advocate. It's important to be an active participant in your healthcare. Healthcare cannot be a one-way street. It's okay to ask for help when you need it. If you're feeling frustrated or overwhelmed with managing your condition, consider connecting with others with similar conditions. Ask your doctor if he or she knows any support groups in your area, or connect with people online who may be able to help you through questions that might be unique to your situation. Next, you want to set realistic goals. It's easy to get discouraged when you have chronic disease. That's how I felt for many years, especially if it feels like nothing is getting better. But there are things that you can do both inside and outside of the doctor's office that can help yourself feel better. One way is to set realistic goals for yourself based on your current situation. For example, if your goal was always to go back to work full time, but now it's not possible because of medical issues, then maybe instead of just set a goal for being able to do more things around the house, or even just getting out for an hour a day with your friends and family. Taking small steps can really lead towards bigger ones. I'm kind of a big fan of what are called micro habits, which is small little positive habits that you can stack, which is do 3 little small habits together to create a better, bigger habit and have more success. Along with your goals, you want to be tracking to make sure your symptoms are not related to other health conditions. And it's important for you to document your symptoms as well. This will help you know when to make the appointment with your doctor. It'll also help them diagnose any problems that you have more quickly. One of the tools we use in our family is called a patient resume with our medical history, because doctors a lot of times only have 15 to 20 minutes with you face to face, And so this really can help maximize that time together. Right, or keep a notebook or diary. Anything you can to share with them will be beneficial for you. As you're doing your treatment plan, it may involve medication, so it's important for you to take the medication as prescribed by the doctor. When it comes to taking medication for chronic diseases, it's important that you only take them consistently, along with the correct dosage level, and all of that should be outlined on your prescriptions. It's also important, I think, to talk to your pharmacist anytime you start a new prescription, because they can be helpful to you in explaining certain side effects or what you should be doing with the new prescription. It's also important to make sure that the prescriptions are consistent month to month, because there are also errors there. Finally, next, you want to check your credentials of your doctors, caregivers, and other professionals that you work with. Choose your doctors wisely. Maybe sometimes if you move, it can be hard to find a new doctor, and that's why you need to network and get out there and meet as many people in the area to try and get recommendations of good doctors that you can count on for you and your family. Make sure to qualify. They are qualified to take care of people like you, with chronic diseases like you. And this can be done by checking their licenses and degrees and other qualifications that is required for every state and country. If they don't have the right credentials or experience to work with people with your chronic condition, then it might be better for you to look for someone that is. Finally, know your rights as a patient. It's really important for you to understand what your rights are as a patient. There's a federal law that was passed called the Patient's Bill of Rights, and that should be given to you every time you go to seek care at a professional's office. A lot of times they have you sign a bunch of paperwork, including disclosures on protecting your healthcare information and so on. You probably have seen this happen when you check in to the doctor. But it's important for you to know your rights and ask for information about your treatment options, including what treatments might work best for your condition and why those treatments would work for you, and or if they wouldn't work for you, why do they not work for you but maybe work for someone else. You also have the right to refuse treatment if you don't think that it's going to help or make things worse. A lot of folks do not realize that. And you also have the right to a second opinion from other doctors who may have more experience working with your specific condition, or maybe have some sort of advanced training or knowledge that might be beneficial to you. So in conclusion, health conditions have to be managed, but this can only be happened if a person knows what they're doing. So having all the facts about your condition and its management will help you maintain a high quality of life, get the most out of your healthcare treatments, and hopefully let you live a healthier life. Follow our page for more tips. If you'd like to learn more, please consider checking out my book, Retirement Healthcare Secrets. It has lots more information like this, including a chapter about how to find a primary care physician, someone that is incredibly important for you in your journey in healthcare. Have a great day.